Around 18,000 people in the UP are insured under the Affordable Care Act, also known as Obamacare. With backlash from Republicans and currently no future replacement plans made public, I reached out to Dr. Terry Frankovich, who explained what positive parts of the reform she hopes will stay.
One was that it included coverage for youth up to 26 under their parents' coverage. That was huge, and that provided insurance for a lot of young adults entering the workforce. Another provision actually helped prevent the exclusion of people with pre-existing conditions from health insurance, from accessing health insurance.
According to Frankovich, the Medicaid expansion along with preventative services could soon be off the table if Obamacare is repealed. Those affected can turn to public health, breast and screening programs, and family plan services.
There are other safety net organizations, but a lot of organizations have also lost funding or may lose funding under a new administration. And so the question is, what will the safety net look like for people who lose coverage?
As some Americans have voiced, the Affordable Care Act isn't a perfect solution for everyone, but for others it has been life-saving.
It's hard to go backwards. It was encouraging to see, certainly from someone who sits in a public health position and has dealt with low-income families and people who've had difficulty accessing care. It's hard to see people potentially lose that access again.
At this time, without any idea what a healthcare replacement might look like, Frankovich said people who have benefited from the provisions should make it known to legislators so there can be thoughtful consideration how to include them in the future plans.
Every citizen of this country should have access to good health care. And I doubt that anybody would want their neighbor or friend not to have access to the care they need when they're sick, or the care they need to prevent them from becoming ill.